My name's Sean McElhaney. I work up at Smoky Point in primary care or family practice department. Well, I was born premature, so I had a lot of doctors when I was younger and didn't always care for some of them, so I felt that I could do a little bit better job at being at least a good doctor than some of the ones I had. So I had always planned on being in medicine growing up. My dad's a physician, he's a psychiatrist, so I also grew up around medicine all the time. I mean, even since I was young, grade school even, it was just something that I felt that I could always continue to learn in. It was exciting stuff for me. I always liked the sciences and the biology classes, those type of things. And so to me, it was just something I'd always planned on. And so then I took a year off after college, went to medical school, and then got into the military, where I did most of my training for the military. Spent 9 years in the military total. The training in the military is a little more intense for the family practitioners because we're expected to do most things in the military. So for instance, civilian family practice docs tend to do maybe 30 or 40 deliveries in a residency to graduate residency. I probably did close to 150 in that time period. A lot more procedures are expected to be done, and then you deal a lot with trauma. So it's a little bit more intensive than the civilian programs are. So when I got out, I felt like my training was better than most. Most rewarding is actually just the feedback I get from patients. When a patient acknowledges, their thanks that something I was able to do for them, that's what really keeps me going with it. It's my method of practice is that I believe in a huge amount of patient education. So I want to be very open with my patients. I don't tend to beat around the bush on a lot of things. I'll be fairly open with them, and I expect the same back from them, to be open with me and to ask questions if they're confused about something. And so in the end, I want them to be as educated as much as possible about their conditions, because the more a patient knows about their problems and what I'm doing for it and why I'm doing it, the more involved they're going to be with their own health care.